Hello, and welcome to your StudyInsured Insurance Orientation. My name is Tallulah, and I am going to be walking you through your International Student Emergency Health Insurance with StudyInsured. So, what do you need to remember from this orientation session? The first important thing that I want you to remember is that you can always call StudyInsured assistance before any medical care or visit to a medical facility or hospital. The second very important thing that I want you to remember is that your mental health is very important, and we have resources that can help. So let's start with the basics. What is StudyInsured insurance? It is health insurance to cover unexpected illnesses or injuries, and it does not cover ongoing conditions or medical treatment you expected to have. It does not cover dental checkups, cleanings, or eyeglasses or contact lenses, and it can be used worldwide except for your home country. So if you have a host parent that wants to take you on a trip to Cuba, you would have coverage during that trip as long as it's not your home country. So how do I use it? You just call medical assistance. Our medical assistance team is here for you. So they help with all medical conditions, big or small. So from a sore throat to, for example, if you've broken a bone, they are available 24/7. So if you have an emergency at 2 a.m. on a Saturday, they will be there to help you. They also speak your language. So if you're more comfortable speaking in your first language or another language, you can communicate in that language with them. If we happen to have an agent who doesn't speak that language on the phone at the time of your call, they can always bring in a third-party translator for you. They will also make sure to help you find a doctor close by. They will also make sure you get the right care, most appropriate for your ailment. And most importantly, they will pay your medical bills. So once they're able to refer you to a doctor that's nearby, we will send a verification of benefits to that doctor so that they know that you're coming to their clinic. Once you arrive at that clinic and receive your medical care, they will send the bill directly to our team. So understanding medical care in Canada. Where should you go? So let's go over the two main types of medical facilities in Canada. The first are clinics. Those are more meant for minor things, like if you have a runny or stuffy nose, a rash, a sore throat, a headache, or sports injury. Whereas a hospital or an emergency room is more for very major emergencies, like if you have a broken bone, if you've been in a car accident, if you have severe bleeding, if you've had a head injury or trouble breathing. So hospitals are more expensive and they have longer waits, and they are more intended for emergencies. So if you go to a hospital for something like a rash or a sore throat, you might be waiting for more than 6 hours just because they will see the most sick person first. So we also have a service called virtual health. It is fast, free, and confidential. So if you call our medical assistance team, you can connect with virtual health through that by calling 1-866-883-9787. So what can happen if I don't call medical assistance? If you don't call within 48 hours of seeking treatment, you may have to pay 20% of your bill. So when you think of 20%, you might not think that that's that much, but it is a big chunk. If you have a medical bill from a hospital that's more than $100,000, for example, that's quite a bit to be responsible for. So it's very important to call and get in the good habit of calling, even if you have to go to a clinic. So if you aren't able to call, for example, if you really cannot pick up a phone and call our medical assistance team, someone can always call on your behalf. So let's talk about your insurance package. From your school, you should have received either a confirmation by email or physically, and it will have a copy of your Comprehensive Plus plan. That is your full policy. It will have information regarding eligibility and your coverage period, definitions on what the benefits mean, as well as benefits and the exclusion. So it is very important to be familiar with that policy wording. The second thing that you'll receive is a copy of your wallet card. So that will include all of your coverage details for this period. It will also have a copy of your claim form. So it is always very important to keep this handy. If you have a claim of more than $500, you do have to fill one of this out and send it over to our claims team, along with any relevant medical notes or records, as well as invoices from your doctor. If your claim is under $500, you are able to send your invoices, any medical notes, right over to our claims team. And if it's eligible, they'll be able to process that. So let's talk about your wallet card. So that will have your name, your policy number, your coverage dates, as well as a StudyInsured assistance phone number. So it is very important to keep this wallet card on you at all times. And you can keep a physical copy, or you can keep a screenshot of it in your phone. Let's talk a little bit about the mental wellness phone line. That was the second point that I wanted to make sure you remember about this presentation. So we have our Stay Healthy at School program. It is a free, confidential, voluntary, and accessible service. It's also available 24/7. So if you need to talk to someone again at 2 a.m. on a Saturday about some stress that you're going through, for example, you can call and they'll be there for you. It is also multilingual and it connects you to mental health professionals. You can access this service also by calling 1-866-883-9787, and it's going to be option 3 on the menu. So there are a few pillars of the Stay Healthy at School program. The first is confidentiality. So rest assured that the records are completely confidential. No one will know that you use the program, and counseling records cannot be accessed by anyone other than the counselor. The second pillar is that it's very voluntary, so no one can force you to seek counseling. You can make calls either with your guidance counselor if you feel more comfortable, or on your own, and you can call and make appointments for yourself. The third pillar is accessibility. So it is completely multilingual. There is over 180 languages available. They are available for urgent requests. So if you are in a crisis, you will have immediate support at the time of the initial call. If there is non-urgent or routine requests, if you just need to talk to someone, but it's not an emergency, you will have a return call within 2 days to arrange a first appointment. So you will have up to 5 sessions with counseling after your initial call based on the counselor's assessment of your needs. So let's talk about the counselor qualifications, because who are these counselors that are picking up the phone? They are qualified mental health professionals. They have a master's degree in social work, psychology, or related counseling fields, and have a minimum of 5 years experience. So for counseling, you can either receive this via email, text, video, phone, or in person where that's available. So how to connect? As I mentioned, you just call StudyInsured Assistance at 1-866-883-9787, and you select option 3. You can also have a wallet card for the mental wellness phone line. All you have to do is reach out to your school and they will provide you with this. The mental wellness phone line can be accessed also at a direct line. So as you notice, it is a bit of a different number here at the bottom. It's 1-833-646-1524. Both are dedicated phone lines for StudyInsured, so either will work. So let's talk about what we learned today. You must call medical assistance if you need to see a doctor, as well as your mental health is very important. So definitely do use that service if you would like to talk to someone. Thank you very much, and I hope you have a great day.